Doctors of Reddit, what is your most, oh my God, what is that moment while treating a patient? Story 1. Well, I'm not a doctor yet, but here is a story from one of my professors. This was in rural Alabama. This middle-aged married couple had presented to the ER after they had been drinking for almost the entirety of the evening and got into a heated argument. Things got heated, and the woman eventually fell off the porch of their trailer into the shrubs a few feet below. The husband, in his drunken state, suddenly dropped the argument and came to his wife's aid. She didn't suffer anything too serious, just a couple of scratches here and there, except for what the man said looked like a piece of glass or a pipe or something that became lodged in the woman's arm when she hit the ground. He decided not to come to the hospital because he could remove this object himself. He got his largest pair of pliers and gripped onto this glass/pipe-looking thing lodged in his helpless wife's arm. He clamped down and pulled, cranked and cranked, trying to remove this object, and it wouldn't budge. After his masculinity was defeated and the alcohol wore off on both of them, they decided it's sensible to finally come to the ER. Upon arriving to the ER, the doctor immediately realized this poor woman had a compound fracture of her humerus, and this pipe or piece of glass thing was her bone sticking through her skin that the husband was trying to pry out with a pair of pliers. True story. Number 2. I interned in a city that gets very cold in the winter. Homeless people who are having a tough time surviving outdoors would come to the emergency department to get admitted, even if just overnight. They'd get a warm bed, a few hot meals, and a cleanup. This one fellow was in really rough shape. Couldn't walk. The poor nurses did most of the cleanup, delousing, sponge bath, dressing the open sores. My job was to do the physical exam, including the mandatory rectal. Literally had to lift that scrawny flap of a butt cheek and pick the encrusted dirt/feces/matted hair away from the rectum to expose the anus. Thankfully, I only had to turn 180 degrees to reach the sink that I dry heaved into. But before this fellow can be discharged, he needs a podiatry consult. His black, gnarled feet had thick, yellow, big toenails that have grown into a circle and are now piercing the bottom of the toe, the reason he can't walk. Podiatrist intern comes in, starts a foot soak, and proceeds to tackle those nails with something that can only be described as modified tin snips. Now, you know how some people have that habit of opening their mouth when concentrating really hard? Yep. He clipped that nasty nail and it flipped right into his mouth. We shared the sink. Number 3. Doctor here. When I was working in the ER one evening, I had my worst experience so far. I was called to one of the examination rooms that are designated for infectious patients. This is already a bad sign, as it usually involves some sort of abscess that needs to be drained. However, this time, it was far worse. I was told by the nurse that it involved a man who had bilateral venous ulcers on his legs and that they were now infected. I looked through his journal and saw that he last saw a doctor about 10 months earlier and no note of any checkups after, not by a nurse or a GP. Therefore, I asked my nurse when someone last took a look at his legs. Not since his last journal entry. Then I asked when was the last time he changed his dressings on the legs. He hasn't. Some background info on the patient. Old man who lived by himself in his trailer that was parked in the middle of the forest. He had no running water. He was a bit of a drinker and a general I don't give an F mentality. Awesome. Suited up and went into the room. The room smelled like an odd combination of stale beer, mold, and disease. Certain infections smell different, and this one was very pungent, almost sulfuric. I introduced myself to the patient, who didn't understand what the F he was doing here. All he wanted was some antibiotics for a flu, and then he was sent here. Why the F do you want to look at my legs for? They were already taken care of last year. Great. So we started unfolding the dressing. They were crusty and crackled as we unwrapped the first leg. As we got deeper, it changed color to some sickly yellow, and the stench became worse and worse. One of my nurses left the room to throw up. Then I saw it. Very small, but inside a fold, there was a little maggot who squirmed. When we finally got to the wound, we saw all the little maggots feasting on this man. There must have been 50 of them. The stench was absurd. I was focusing a lot to breathe through my mouth, but then it felt like I could taste it, which made it even worse. My nurse came back and promptly went out again. I unwrapped his other leg, and same story there, but the infection was much deeper, and I could see a few tendons on the base of the ulcer. Absolutely delicious. We had to clean out the maggots and place them in a bowl, but they were squirming and went on the floor and crawled all over the place. I had to watch my feet so I didn't step on them. After that, we took the patient to hose him down to at least try to get rid of some of the smell, then booked to the OR for debridement and a fresh vacuum dressing. Discharged a few days later with strict instructions and booked him in to return for redressings and checkups. Then we never heard from him again. TLDR, maggots. Lots of maggots. Number 4. Paramedic here. While working in the ER one night, we had a guy come in complaining of groin pain. So we bring him back, and it turns out he has a master lock, the kind with a spinning dial that you use to secure your locker at school, locked around his penis. Essentially, blood could flow in, but could not flow back out, so this thing was hugely swollen. He had panicked after he realized he could not remember the code, dealing with a real genius here, and he took a screwdriver to the dial and snapped it off. So we consulted with urology, and the urologist wanted to take him to surgery, cut his ween length-sized, slide the top out, then the bottom, and then suture it back. Needless to say, the patient wasn't thrilled with option A. So option B was for this big nurse, we'll call him Tom, to go in with bolt cutters and cut it off. Option B selected, curtain closes, Tom gives a 1, 2, 3, a loud scream, at 3, a pop noise. Tom exits with a broken lock, and the man was sent to the floor to recover. That's just one of so many, but I always tell that one. Number 5. Just a couple of months ago, actually, woman about 35 years old comes in for a pap smear. Okay, no problem. Put the speculum in and maneuver it around a little bit to find the cervix, and I see something dark brown in the right lateral fornix. My first thought was, oh crap, cancer. You see, when I was an intern, I had a patient on whom I found very dark, friable tissue on the posterior wall of the upper vagina, which eventually turned out to be rectal cancer that had spread into the vaginal wall and was quite advanced. You know, one of those patients you kind of never forget. Anyway, I try and gently scrape at this dark brown area to get a feel of what it was when the smell hit me. I imagine if death itself died and rotted for a few weeks, that is what it would smell like. My medical assistant scooted away to the edge of the room. Poor thing couldn't leave the room as she was my chaperone. I stopped breathing through my nose and started to breathe only a couple of times a minute from my mouth, of course turning my head away from the source of the smell to take a breath. Anyway, maneuvering the speculum a bit more and scraping a bit at the brown area some more revealed an answer to the mystery. It was a cylindrical thick wad of something. An old tampon. The patient had no idea that it was in there, and her period had ended over a week ago. So this thing had been there for over a week, and the lady was walking around, living life as usual. Thankfully, she didn't get TSS. Retrieval of the tampon was uneventful, and the lady was sent home with advice on being more careful when remembering to take out tampons, or perhaps consider switching to pads instead. Number 6. Token, not a doctor, but I am a nurse and I have a story. I was working in the emergency department one afternoon, and we had an elderly lady just calling out, help me, repeatedly, all afternoon. She was brought in by her nursing home for agitation, which is normally code for they can't handle them anymore. So the patient was placed with a carer assistant to try and calm her down and make sure she didn't wander around the ward. The carer was helping to feed the patient, and I walked past when suddenly the lady just breathed her liquid diet in and collapsed backwards. I, of course, instantly pushed the med emergency button, and everyone comes running from all over. We assess her airway, and it's deemed clear, but not self-supporting. No food in there, which was strange. She wasn't breathing, and no heartbeat was present. So one of the male nurses starts compressing on her chest, while another nurse tries to insert an airway. As he compressed on her chest, a literal fountain of murky green goo spurted from her mouth, all over the walls, ceiling, medical staff, literally everywhere. And of course, we're all like, what the hell is this crap? And the poor male nurse had to keep compressing the chest while the other nurse kept trying to suction the patient's airway to clear it enough to insert an airway. After 5 or 6 minutes, the nurse finally gets the airway in after suctioning over 6 liters of this goo, and after some defib, the doctor declared the patient dead. The bay and the surroundings, say 5 or 6 meters, was just drenched in the slimy, murky, brown-green mess. It was absolutely breathtakingly disgusting. Eventually, we found out the poor old lady had a massive bowel obstruction, had a cardiac arrest while eating, and the goo was days and days of liquid fecal matter. Safe to say I scrubbed myself raw in the shower that night. Number 7. My mom is a nurse and has seen some pretty messed up things. The one story that sticks in my mind involved an elderly man who came into the hospital 3 times a week to have a growth on his face washed and redressed. The growth had slowly taken over the left-hand side of his face, so much so that his left eye, his only working eye, had closed over. He was effectively blind. This meant that his wife, whom he had been looking after for years due to her frailty, was now tasked with looking after him instead. Furthermore, this bloke was old enough that the hospital didn't want to operate on him. So the hospital visit stopped. He could no longer get there, so instead a nurse would visit him 3 times a week. Now, this growth was unsightly, wept constantly, and smelled bad. Really bad. The whole house stank of it. The nurses said it smelled like death and thought he was going to die any day. During one of these visits by my mom, she was cleaning his face over the sink and noticed a flap of loose skin. She went in to clean it with the sponge, and the growth fell off into the sink, and it was crawling with maggots. The sink was now filled with dead flesh and maggots. And the smell, oh my gosh, the smell. Turns out a fly had laid some eggs on it at some point, and they'd hatched and started eating all the dead flesh in the growth until it fell off. And the man? He was fine. There was new pink skin where the growth had been, and he could see again out of his left eye. Gave him a new lease on life. Heartwarming story? Yes. Most disgusting my mom has ever told me? Hell yes. Number 8. So, the birth of our second child, my wife and I decided to go with the home birth option. Long story short, she was in full labor, dilated, and starting to push, but her waters hadn't broken. The midwife who was there said it was no problem. So my wife is lying on the ground, and I move into position to catch the baby. She starts to push, and her waters burst. Except instead of clear fluid, I am now being liberally saturated in bright green fluid. It turned out my son had pooed during the labor, and this was mixed with the amniotic fluid. So, my eyes are the size of dinner plates, This liquid is pooling around my knees in something that resembles a scene from the original miniseries of V, and I am not entirely sure what is going to be birthed, human or reptile. Luckily, the rest of the birth went fine, and my son arrived into the world less than a minute later. I'm saving this story for his 21st. Number 9. There was a patient who came in, well-known history of diabetes. When I saw him, the worst of it was already over, but he still had legs like sausages, and the smell in the room was like a garbage dump. There were these strange bands around his ankles that were indented to over a centimeter deep. Apparently, he had developed an ulcer on his foot, so instead of cleaning it and bandaging it, he decided to just put a sock over it. Eventually, the ulcer developed into gangrene, and the pus began to soak through the sock. The smell became overwhelming even for him, so he decided to seek medical attention as a reasonable adult would do. Just kidding. He put a plastic bag over it. Eventually, the pus seeped around the edges of the bag and started leaking again, giving rise again to the horrific smell. So now things were getting out of control. So now he decided to get it properly looked at. Got you again. He put another plastic bag over it. This process repeated about 9 to 10 times. In the ER, they had been peeling off this giant mass of plastic and dead tissue glued together with pus and held on with elastic bands around the ankles. That's what the indents were. It was like his foot turned into a giant pus onion, with each layer smelling worse than the previous one. 2 or 3 nurses apparently threw up, and they had to rotate people in to do the next layer. He wasn't even in much pain because he had long-standing neuropathy in his feet, which was why he was able to ignore the problem for so long. And that's why you always leave a note. Last story. I was working as a scribe when we went to see an 8-year-old girl that had a fever. Nothing too remarkable until we started the physical exam. We examined her head, normal. We examined her upper extremities, normal. Then we pulled up the blanket to examine the lower extremities. Her feet were the size of an infant's. You should have seen the look on the doctor's face as he was trying to figure out how the girl's feet got so small. The mother looked up at the doctor, saw the look of confusion on his face, and said, "Those aren't her feet." She pulled up the blanket a little further, revealing a pair of perfectly healthy feet, nestled next to the feet of a doll that she had put under the blanket. We saw the doll's feet and thought they were the girl's. Edit. For those wondering, she had the flu. She turned out fine. I hope that last story made you smile. You earned it for getting through all those horrible ones. Please like, comment, and if you subscribe, I will literally squee. And also have a good day. You deserve it.